call today. Here's the secret entrance. Call for psych, and this is what we fill out for patients, and then kind of admission paperwork, but you know, all the things we can ask. Time to eat dinner. Some udon with some. Leaving the hospital now. Was on call tonight. The typical emerge mix is suicidal ideation. People who get called back on what's called extended leaves. Legal document that if you don't comply with the medications, then you can be taken back into the hospital to get your treatments that you're missing out. So that's what I saw. It was like first time like talking to a patient myself in like seclusion, which means like when someone's like being violent, extra security, and they put in this room that basically looks like a mini jail. So this is like an alarm you wear in the center, and so if you're being attacked by a patient, which can happen, you kind of press it. The danger is like you have something like this, and so if a patient's trying to choke you, it rips off. See, let's go home because we got an early day in clinic tomorrow. Little parking lot at night as I'm leaving on call. Went for a quick run after work, and this all it counts is it showed up, even if I ran super slow. This morning I've been doing different modules in psychiatry, so learning about like dementias. Actually, those are not called major neurocognitive disorders. And now I'm just working through some more extra readings. Right here I'm just reading through different sleeping disorders, for example sleepwalking, and learning risk factors, treatments, and I'm just taking some more condensed minimal notes on the side. Just doing scrubs and have a little personal pizza to eat before call. That's what it looks like. What were our day today? Oh, I'm still wearing a mask and a cap. Child psychiatry from home, so that was pretty interesting. In the morning we had a lecture on ADHD, which is a disorder first diagnosed in children in which they're inattentive, very hyperactive, difficulty focusing in school, and so we talked about how to diagnose that and how to treat it. And then in the afternoon, then we virtually watched our psychiatrist interview a patient who had it, and then how the psychiatrist counseled the patient on how to take medications and modifications that was possible. It's pretty interesting. So, because I find ADHD pretty interesting, that when it's well treated, it can be dealt with pretty quickly. I wanted to recommend a movie. This is the English title. Kim Ji-young, born 1982. Big feminist movie, and the core story it follows is that a young woman, she and it kind of goes through different flashbacks, but basically it tells her story from her childhood until now, as a young career woman turned into a young mother, about kind of how sexism has played a big role into her life. So starting from her childhood, that expectation growing up that a young girl is, must be quiet, they have to do more chores than say a male sibling, but how in the workplace there's a lot of inequality, and I think that there's a big pay gap, how women get passed up for promotions, the way women are treated when they ask for maternity leave, and or trying to come back after work after maternity leave, and the expectation they're supposed to sacrifice their careers for the children. So she does that, and she's quite unhappy because she left her job. Finished another run, and I'm really I'm so out of breath. Just wanted to practice gratitude as well. I feel really grateful that I have a healthy body, and that I have a body that I'm able to exercise and use to enjoy the beautiful weather and keep myself healthy. When I see a lot of people that are ill, it makes me feel much more grateful for what I have, and instead of things like maybe before, envy that we want to look like certain supermodels, I just feel grateful for the body that I have. I'm also grateful for such beautiful weather. A little blue sky, it's more like a grayish sky, but it's kind of a nice, not too hot So recently I finished a fiction book called Someone to Love. Specifically, that book's about anorexia, binge purge type, or anorexia. It's more than just body image. It's like a coming in with a lot of anxieties, a lot of worries, a lot of feelings about yourself, self-loathing, as well as some of the very dangerous effects that can come from starvation. So that's like electrolyte disturbances, being very weak, cognitively always being in a fog. So anyways, I really highly recommend it if you want to learn a little bit more about eating disorders. I ordered 2 books off Amazon. This one's called Stress in Medicine. So this book is called Reflections of a Pupil. Looking for a book to just learn more strategies to deal with stress and the kind of things about medicine. And so this is a quick outfit idea for someone. This is just like a black sweater. It's a bit loose, not like overly fitted, with a long knee-length skirt and then some thick thermal tight. This scrubs, but on like something like psychiatry, you do have to wear professional clothes, or this is good for clinical skills for first and second year. So turtleneck, I like turtlenecks. I think dress shirts are cool. I like skirts more. Tights always like make it more professional and warm. Some kind of professional looking shoes. And then I like throwing on a blazer because it's like a bit... What's that? What's that? What's that? If you guys watched my last vlog, I ended up really pretty burnt out, and my new rotation appropriately psychiatry. So I thought I'm gonna go on an experiment, try different things to increase my energy levels, feel happier in the day-to-day. I think the first thing I'm doing today is, instead of always trying to cram work into all the spaces, I got a chance to take a walk at lunch, which is super unusual for me. I love to like do emails and clean and whatever. It's just like jam productivity all the time. So now I'm just trying to take a walk, enjoy the lovely weather, take time for myself. I spent so many days indoors and kind of at the hospital before the sun is up and leaving after sun's down. I didn't really notice how beautiful the sky is. You know, it's not green and leafy, but it's really pretty. Everything's green. Hello. So the second thing I'm trying to do is exercise. Trying to exercise today, get strength in the morning. Tomorrow I'll run again, and hopefully that helps with sleep and energy. I think 3, resisting the urge to nap. So, you know, having 15 minutes before we have clinic at 1. I just really want to take a nap for 15, but I know in the long run that taking a walk will actually be better for my energy levels